When should you consider a drug holiday for osteoporosis medication? When should you consider a drug holiday for osteoporosis medication? This is a question many people facing osteoporosis may ask. A drug holiday refers to a planned break from medication, particularly bisphosphonates, which are commonly used to treat osteoporosis. These medications include Alendronate, Risedronate, and Zoledronate. Typically, a drug holiday is considered after a patient has been on bisphosphonates for about 3 to 5 years. During this time, it is essential that the patient has stable bone mineral density and has not experienced any new fractures. The reason behind this pause is that bisphosphonates can remain in the bone for a long time, continuing to provide protection against fractures even after stopping the medication. There are several key factors to consider before starting a drug holiday. First, the duration of prior bisphosphonate therapy is crucial. Most guidelines suggest that after 3 to 5 years of continuous treatment, a drug holiday may be appropriate if the patient's bone mineral density is stable and no fractures have occurred. Next, the patient's fracture risk plays a significant role. Drug holidays are generally recommended for individuals at low to moderate risk of fractures. If a patient is at high risk for fractures, it is usually best to continue therapy without taking a break. The type of bisphosphonate used also matters. Different bisphosphonates have varying potencies and how long they remain effective in the bone. For instance, Alendronate and Zoledronate tend to have longer-lasting effects compared to Risedronate, which can influence how long a drug holiday can safely last. Monitoring during the drug holiday is essential. Regular checks of bone mineral density and clinical risk factors help to identify any loss of bone density or new fractures. Depending on the medication, bone density tests may be done after 1 year off Risedronate, while testing may occur every 2 to 3 years off Alendronate or Zoledronate. Individual patient factors are also important. This includes total exposure to bisphosphonates, sex, body weight, fall risk, and other health conditions. These factors can influence both the decision to take a drug holiday and its duration. It is important to note that drug holidays are not suitable for all osteoporosis medications. For example, denosumab does not have a prolonged residual effect once stopped and requires continuous treatment or a switch to another therapy to maintain bone protection. Because the decision to start, continue, or end a drug holiday is complex, it should always be personalized. Consulting with a healthcare professional who specializes in osteoporosis management is essential. They can help ensure that the benefits of fracture prevention are balanced with the risks of long-term medication use.